Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we have great guest as well as great topic. It is story of every household because we are all approaching golden age and what it means, new set of challenges, new set of things which we need to discuss. And remember, it is story of every household. So send us questions. We already have a lot of questions on that. Let's first welcome our great guest, Dr. Jamil.
Hi, this is Dr. Ahmed. I'm an internist and also geriatrician. So as a practice, we deal with a lot of older people. And as a nation, we're getting older. We're seeing more of them. And they have a different type of challenges, as Dr. Moby said already, that we have to face things that we never faced before. And my topic is one of those.
Okay, very nice. So tell us about what are these golden years?
You know, there is nothing golden about it. But we know that we have made it through our life. We had a good working life, raised the children, retired with some sort of financial security. I think that's all about it. That a job well done in my life. That's how I look at the golden time.
So the golden time is about, I think, this is a time where everybody should enjoy life. So I think, in my opinion, I always counsel all my patients, you have earned this life or lifestyle. I mean, there's a reason you worked hard all your life to reach this point. And the worst thing you can do is you get sick and unable to enjoy.
Yes, I agree completely.
So there are, I think what I see is there are certain expectations people have, or not expectation, but also proper word would be, they had this prototype of this age before, which has changed dramatically because over time this has evolved because we were first of all never living that long. So average age has gone really up. And the other thing is, so there are new set of challenges. We're going to discuss few of them, but most important thing is this reality that we are all going to live longer, and thanks to medical advances, thanks to all the technology, and also people are actually wishing that they can live and enjoy the life. So tell us a little bit about what is about families' need which you commonly see with these.
You know, there's a lot of expectation in our life as we grow older or as we age. There is a popular belief that old age signifies asexuality. I'd like to talk about that part, but otherwise it's going to be such a long talk if you touch every piece of it.
Yeah.
It may be true for some people if they are having some physical disability or having some issue with a hormone or psychological problem like anxiety, depression, or if you look at the physical part, it can be a stroke, it can be heart failure, heart disease, Parkinson's, have trouble walking. So there's a very lot of things that can go wrong, and it can make you less functional. In our office, people will rarely talk about sexual issues. It still is a taboo in our culture, especially on older people, and finds it embarrassing to talk about it. So it is our responsibility that we pick up the topic and talk, because then they will open up and discuss the issue. Sometimes it is the wife or girlfriend picks up the topic instead of a man.
That is interesting. You said usually the family will bring that on.
Yes. Yes.
And is that because family has different expectations, or they? So tell me a little bit about that. How do you educate
I think as a man, we have certain ego issue.
them?
We don't talk about these few things. If you have issue with the sexual dysfunction or some problems, you feel that you're not up to the point of functional,
Mm-hmm.
and you degrade yourself.
Mm-hmm.
So I think that's why they don't want to pick up that topic
Mm-hmm.
publicly. In women, I think they are more open about it
Mm-hmm.
when given chance.
Mm-hmm.
But if you look at all the census or records, you find that both men and women, when they're interviewed, they are all say that having sexual function is very important. Even throughout the age and the boundaries that we put on people's life, and they relate this sexual function with well-being, joy,
Mm-hmm.
and romance. So it is very important that we talk about it, and there is few things that we can do nowadays to make things better.
Mm-hmm.
Sometimes
Mm-hmm.
people like to have a company because they like to share their views, opinion, ideas, worries. Sometimes it is just necessary
Mm-hmm.
to put someone to lean on.
Yeah.
And as we get older, we have a less likely to find a partners that we can do. Sometimes we see this happening in a personal care home or a nursing home, and that really bothers the family member, especially children. They have a mixed feeling,
Mm-hmm.
and but they will find that their parents are much happier now than they used to be. That should give some clue why the relationship at any age is important.
And that is the important discussion that you said that things have changed a little bit. So they should focus on well-being of their loved ones. What makes them happy, rather than we think that if they do this, then they should be happy.
Yes,
So we should think about their happiness.
yes, and one of the saying in the culture is that
Mm-hmm.
when people get older, parents get older, they have to go to a nursing home or a personal care home.
Mm-hmm.
And the saying is, be nice to your children. After all, they are going to choose your nursing home.
Mm-hmm.
And that is true
Mm-hmm.
for a lot of cases.
Yeah.
But maybe not appropriately said, but children has a moral obligation to their parents and to find a nice place so that they can rest. Because life is so hectic. Taking care of somebody is nowadays is very difficult by one person. But when you look at the nursing home or personal care home, we'll look at the environment of that place and the cleanliness, pleasant stuff, space, activities, reputation in the market, and of course the cost. But we never thought about their romantic need.
Yeah.
And let me give you a scenario. Husband and wife decide to go to a personal care home because they are not able to handle this at home because of some physical issues and issue with some cognitive impairment or mild dementia. Mother has dementia, so she gets agitated once in a while. She will try to wander at night They will try to sneak out of the door. So it becomes a problem for a personal care home.
Yeah.
Otherwise, during the daytime, she's not that bad. One day, nursing staff found that both are in the same bed and disrobed themselves. And nursing staff didn't know what to do. So this is a big dilemma, what to say to the person, husband, wife, staying in at a place where they are involved in activities they have done for last 50 years.
Yeah.
So this is a question that always comes, and we think about, is patient is able to make that kind of decision? Mental capacity. We get psychiatrists, medical doctor involved in it, but basic idea is that staff should try to maintain privacy as much as possible, even if it's a personal care home or a nursing home.
Yeah. So what you're saying is, if they see, they should have some kind of sign or do not disturb or something, that the staff can put that, so they can have intimate moments, and that don't make it too obvious to families, as because that's their right.
That's the right.
So putting somebody in nursing home or these facilities doesn't mean they're going to prison. Okay. So even in prison they can actually have. So that's important.
So basic idea is to improve the quality of life, even they are at nursing home or a personal care home. The concept of person-oriented care was mandated in 1987 by Omnibus Budget Reconciliatory Act, which was signed by President Reagan. The idea was that nursing staff should be given training to deal with this type of issues, nursing issues, and they have to complete a certain time period for the training. There will be competency evaluation to make sure that understood what they are getting into, and recommendation to make nursing home feel like home, which will respect autonomy. It is difficult to come to a conclusion about what to do this patient because there are a lot of other people in that place. So you have to make sure that structure of the building will be in such a way that you can maintain privacy. There will be curtains in certain places that can be pulled to maintain some privacy. Few things has to be controlled, like giving medication to the patient because they may not understand or they may not know when to take it. So those things has to be kept at nurse's hand. But other things, privacy issues, probably structured in such a way that patient will not have to ask for privacy space.
Yeah.
Because it is involves the dignity of the patient and life. Sometimes nursing staff will raise the issue of competency of the patient to make a decision, especially about sexual interaction with other partner. It is a very difficult issue. It's a gray area which has to be dealt with cautiously by a psychiatrist and the medicine doctor. Sometimes you have to make sure that you communicate these things to the nursing, not family, so that they are aware of what's going on in this place, and so that they don't get all surprised all of a sudden, because they will have to make a judgment about this before it goes overblown.
Yeah.
It's a delicate issue.
Yeah, that would be, delicate for family to understand. So you think if we educate them about, that they as close to the real life they should have, so that kind of expectation family should have,
Yes,
and the privacy is important.
yes. That probably place they are living in
Mhm.
should
It should,
maintain some sort of structured
yeah,
place.
maintain some, and also it's important discussion, as you said, that is a law, and the staff has to be educated so they have a reasonable expectation about that.
Yes. Let me give you another
Mhm.
situation. There is your mother or my mother or father get involved with another person. Irrespective of age,
Mhm.
we continue to long for relationship, touch, and love.
Mhm.
Even our old age, we all will appreciate these things. We may like to just sit down in a chair
Mhm.
next to each other, sit at the same table to eat,
Mhm.
and enjoy each other's company. There is a few instances that when there's this type of relationship, they are happier than other people.
Mhm.
They will get up in the morning and looking forward to go to the breakfast table as almost like going to a date. They'll
Wow.
dress up,
Mhm.
comb their hair, put lipstick if that's necessary,
Yeah.
then go. So this is improve the quality of life. And people like me and others may not understand that, but at that point of life, it is very important for them. And they are happier that way. We are getting older.
Mhm.
Men, life expectancy is less than women. If you see that, therefore, every four men, there's a 10 women in a personal care home or a nursing home. And the term baby boomer comes up,
Mhm.
and baby boomer are sexually active throughout their life most of the time. And even they get older,
Mhm.
they tend to continue that.
Mhm.
And there will be expectation that when they go to a nursing home or personal care home, that type of relationship they will be able to continue.
Mhm.
Do you have any question about baby boomer?
Yeah, yeah. I think I get some of these questions were popping, and actually I'm seeing that. First of all, they say why love is needed for baby boomers already. So, what do you say about
Well, we are that generation,
it?
1960s wild generation.
Mm.
There's a lot of experimentation.
Mm-hmm.
They're more sexually active.
Mm-hmm.
And when they get older, they continue to do that.
They kind
So we call people born between 1946 and 1964
mm-hmm.
are baby boomers. That's a generation that started after the Second World War.
Mm-hmm.
Generation before that they call silent generation. You rarely heard about them. They are hardworking. They they have a less uh, requirement, and they just lived. Compared to baby boomer, their expectation is very high and loud.
Mm-hmm.
Baby boomers are called shockwave generation.
Wow.
They changed a lot of things in this world
Mm-hmm.
because their expectation is so different.
Mm-hmm.
And they have a higher education level
Mm-hmm.
and a standard of living,
Mm-hmm.
and they demand change. They're not happy easily.
Mm-hmm.
So they're not pacifistic.
Mm-hmm.
Of course, they're not monolithic. There's a lot of people born in that time are not typical baby boomers. And that's the way it is.
Mm-hmm.
There's not a cookie cutter rule for everybody.
Mm-hmm. Yeah. Also, I want to ask. We got a question about that my parents are on any medication, and would certain medication make them more or less hypo or hypersexual?
Yes, most of the psychiatric medication, lot of blood pressure medicine has effect on the body, and they can decrease your libido, they can make you tired.
Mm-hmm.
There's some psychiatric medication like they call SSRI,
Mm-hmm.
like a Paxil, Lexapro, things like that, can cause some upregulation or into desire for sexual
Mm-hmm.
attention. There is some Parkinson's medicine
Mm-hmm.
can cause the similar complication. So if you have anybody in your family has this type of issue, I'm sure your doctor will look into the medication list and to see whether any medicine doing it. And that may be an easier fix than giving another medicine to control it.
Okay, yeah, that is important, and also for audience sake, I want them to be educated on. So there are certain medications, especially dopamine, which we use for Parkinson's, but there are also which we use for restless leg,
Yes.
and then they re-equip, and not by brand name, but those medication, European, and they are can cause same side effect. Also remember, there is entity which we call sexsomnia, which people could have sexual encounters or being sexually active during sleep and not aware of that, or they have no recollection whatsoever. And that is also the side effect of SSRIs, certain, and they are known to do that. And also there could be other reasons. So if there is a problem, make sure get a sleep specialist also involved. But I think it's important to realize, yes, there are medications that can cause that, but it is very important for us to understand the social dynamics of this. So we have make sure focused on family, and then the kids will be less acceptable. Now tell me, what is your experience? Is that less expectation from mother or father? Which one or both? The kids react the same way for both.
Most of the person are mothers
So
because they live longer.
yeah, that's it.
And but it is from the both side.
Okay.
I have found that the people or children came to the personal care home and nursing home and took their parents out and took a different place because they are getting involved with another resident at the place.
Oh, they took them out.
Yes, and because they just couldn't deal with it.
Mm-hmm.
So, as a healthcare worker,
Mm-hmm.
we have some responsibilities. Like you have to make sure that the patient is able to give a consent
Mm-hmm.
for this type of relationship,
Mm-hmm.
especially if patient is dementia.
Mm-hmm.
It is very difficult to categorize, but people with the dementia, there is a different level of dementia.
Mm-hmm.
So if somebody is understands what's going on, it may be okay, but some people who is completely demented probably is not okay.
Mm.
Nursing home staff should be aware that what is happening in that place,
Mm-hmm.
and you just cannot ignore, and have to make sure that this relationship is consensual.
Yeah.
Family should be aware, and that may prevent a lot of conflict later.
Yeah.
Because ultimately they will make the decision what they expect from their parents.
Mm-hmm.
They may not make the right decision, but they have the right to make the decision.
Yeah.
And the concept of consent is a very difficult and a gray area, especially with dementia issue.
Mm-hmm.
Some of the higher level of functioning is easier to discern, but sexual dysfunction and the sexual relationship are maybe less clear cut. When we talk about sexual relationship, it doesn't mean that you have a physical interaction. Sometimes it may be touch or hug, something like that. And sometimes it is not appropriate according to the patient's family, but that's what they want. There will be an issue of HIPAA violation, how much information you can pass on to other people.
Yeah.
So we have to be aware of that too. Nowadays, since we are allowing more things to happen in nursing home or personal care home, nurses are not only allowed to make sure that it's safe, but you may have to discuss about safe sex. Not only about condom, but also about health issues. Whether you should get involved in something vigorous when your heart is very weak, or you have a risk for fall and things like that.
Yeah.
So you have to discuss that with the patients clearly so that they can understand. Sometimes one of the partner will be more aware than the other. So it'll be wise to talk to both of them.
Yeah.
Nursing staff should be respecting this type of relationship and expecting. As baby boomers are going through the transition of this type of structured living, more people will be expecting this and more people will be seeing this happening too. And we all know people who has relationship, some sort of relationship, are happier than people who didn't.
Yeah. Yeah,
I
that
think-
is it.
I think that's all I can talk about.
Okay.
Do you have any?
Yeah, we got a few requests, and one was about what is the best way to handle? Is it to do a family conference?
Well, anytime
Mm.
there is an issue with a patient or person, we always ask the power of attorney to come and talk, because we want them to make the decision and aware of what's going with their parents. Because if we don't talk about this in detail, it may be a problem, and it can be nasty at that time.
So those are any final thoughts you would have for the family? They are about to ask about this problem. Any final message you would like to give?
Yes, as we get older, and we have seen that our parents got older and what they have gone through, with our experience we know that having relationship, any relationship, is better than not having any. It will make them happier, more adjusted, and less agitation, because they have somebody they can talk to and sit down and somebody can console as a friend, not the nursing stuff. So it is important that we keep that in our mind, and I think it will be good for everybody.
And that is a great topic, and also I think I can envision a few years from now the newer generation will be on social media,
Yes,
so there will be a lot of topics on social media
yeah,
about this topic and other topics, and right now they are not, but I can envision that coming soon.
yes. I think that because of our taboo about discussing sexual issues, especially if you're older, I think when more people are having this stuff of issues and facing the problem, more people will be talking about it, and the places that they are living will be more aware of that. What is the right of the patient? And if they want to have a privacy, they should get it. And these baby boomers will be in charge to make that change.
Okay, well, thank you for coming and explaining that, and that is a very delicate but important topic. So, bottom line is, everybody has a right to practice their life, and also putting them in a facility doesn't mean they are prison. They have all the rights, and it's same way we love them, they need also love, and this love can have different language. So love is same love definition, but there is a love for family, but they have also intimate needs, and we have to worry about their privacy. We have to give respect. We have to honor their wishes, and it'll never be just physical involvement. It could be just sitting together, holding hands, listening to each other, and maybe have interest to have some kind of companionship all the time. And so these are very important things to consider when kids or family or physicians or everybody look at. So my take is make sure we all come to a conclusion and understand the whole concept of this rather than one part of it. With this message, take care and stay safe and be blessed.
Thank you very much.